specific biomarkers for melanoma?
Well, are there specific biomarkers for melanoma? Yeah, one of the main ones is whether a melanoma is BRAF mutated, yes or no, and that actually makes a lot of treatment possibilities different as compared to the BRAF wild-type melanomas where you only can propose immunotherapy. But actually for both, immunotherapy in general is the first choice.
Besides, I agree with Lex that BRAF really is the most important. I think there's some other markers that really help understand the prognosis. However, it doesn't at this point affect their therapy. And in the future, if we design trials optimally, those will be used to improve our treatment.
What is your secret talent that has absolutely nothing to do with your job?
I'm not sure I have any secret talents, but I certainly love to see the arts, especially when my daughters perform them.
I actually never went to a lecture in medical school because I was the lead singer in a band. We toured the United States in 1974 when Nixon resigned. He couldn't take it.
More current advantages of predictive biomarkers or more limitations in their clinical use and application?
I think the really advantages, as I said, really can help you understand the potential benefit or lack of benefit. The limitations right now is that besides BRAF, none of the markers that I know of dictate therapy. It just gives you information that hopefully in the future we'll use.
We don't have an absolute decision-making biomarker in melanoma that tells you you should get immunotherapy or you should not get immunotherapy. Even if you use a certain biomarker and that biomarker is high or low, then still if it's only low, the response rate to immunotherapy is still high enough to still give it. So we don't have a decision maker. And that's what we're waiting for in the evolution of biomarkers in melanoma.
If you had a time machine, would you choose to go to the future or the past?
Well, that's very easy to answer. I would probably want to go to the past. I mean, with the state of the world right now, I don't really want to take my chances.
I would go to Firenze for the Renaissance and I would like to meet Leonardo da Vinci. And he would be scared.
I would love that too.
Can blood tests tell if immunotherapy is working?
Yes and no, quite honestly, because mostly we look at shrinkage and vanishing tumors to say it's working. But there are now tests where you can see how out of the blood certain markers or circulating tumor DNA is disappearing while you are treating patients. In melanoma, ctDNA is not so good, but in other tumors, it's a very good marker of tumor shrinkage and disappearance. So the answer is yes, but we're not the best in the melanoma setting compared to other tumors.
Actually, I think there's unique situations where the blood can potentially provide some great insight and maybe change therapy or at least continue therapy. And that's in patients early on who are getting immune therapy. A subset actually looks like they're progressing their tumor. And if you look at the ctDNA, it looks like it's helpful to predict that they will respond, even in the setting of progression on the scan. And I would add, CAT scans have major problems as well. And there are many other things, and probably the way the patient feels in many cases is more relevant than most things.
What do you like about Naples?
What's not to like about Naples? So I'm still waiting in great anticipation when the Vesuvio will spew fire again. And I hope to be here at some point in time when that happens. I was twice at the Etna when it was erupting, and it's so phenomenal. I hope to see that here. You know, a minor spew, but a nice one, yeah.
You know, there are a number of things I like about Naples. Certainly the waterfront in a nice day like today is just awesome. And the food and the pizza and a number of other things too.
And the people.
That's where I was
and the San Severo Chapel.
That's right.
That is like second to none in this world.
Is it better to be BRAF positive or negative?
It's always better to be positive in life, and actually that is also true for melanoma to some degree. There are some indications that the BRAF positive patients already actually initially are also responding better to immunotherapy propositions. But on top of that, if that would not work anymore, they can still receive the BRAF-MEK inhibitor combo. So you have a certain advantage being BRAF positive. Yeah.
Yeah, overall, I think it is an advantage. But actually, some of the data suggests that patients with BRAF mutation may actually do better than those without the mutation if they get immune therapy as well. But to have an alternative treatment or a second-line treatment is always better.
If you were stranded on a desert island, which two items would you want to have with you?
Probably music. It doesn't have to be live, and obviously, I guess I can hunt for my own food, but obviously I need food, and those are the main things.
A piano. I only need one tool. The other one something to sit on to play the piano, yeah.
Cats or dogs? Or both?
Neither.
Oh, that's a very easy question to answer. Dogs.
In your opinion, are biomarkers needed to target melanoma immunotherapy?
Well, in the end, we would like to have a couple of biomarkers that will provide very good guidance to which choice to make or in which order to give a certain number of options of treatments, but that so that it would tell you it's best to start with, for instance, anti-PD-1 plus anti-CTLA-4, and then that was your best first proposition under these circumstances, because biomarker A tells you to do that. And then if that would no longer work, then there would or might be another biomarker B and C that tells you now option B or option C would be the better option to follow. Right now we don't really have that, other than that in general we tend to start with immunotherapy in advanced melanoma and then see later what else can happen.
Yeah, I agree that really right now the biomarkers at least don't help us with deciding what treatment to give. I think in the future, I think there's a good chance that they will help even define patients who should get targeted therapy. Dr. Drummer gave a wonderful review. There is a number of patients who have targeted therapy and are live free of disease, even at 7 years. So I think there are unique patients that if we can define in general how to approach it better, then biomarkers would make a huge difference.
How would you describe yourself in 3 words?
Impossible, but big heart, big cuore, and profoundly optimistic, always.
I would say dogmatic, argumentative, and another would be sarcastic. And then I agree, I think I have a good heart and in general want what's better for others.